Hello and welcome to another tutorial designed for you by OSCE Station. In this tutorial we will be covering all things ECG and running through how to approach an ECG in an OSCE station. An ECG is a device used to record the electrical signals of the heart. It is a non-invasive way of diagnosing common heart conditions. ECGs should be performed in patients experiencing chest pain, dizziness, palpitations, shortness of breath, weakness or fatigue, and in those whose pulse is abnormal. In a typical OSCE station, you will be given a scenario like this. Mr. Smith presents with shortness of breath and chest pain. Please take an ECG and present your findings. You will demonstrate placing the ECG leads on the mannequin, and then the examiner usually gives you an ECG to look at and describe the findings. We will cover how to do this next. So first things first, turn on the ECG machine and make sure it is working and calibrated correctly. So the ECG paper speed should be 25 mm per second, and 1 MV of electrical activity should equal 1 centimetre on the grid paper. Explain the procedure to the patient and get their consent. When explaining the procedure, reassure the patient that they shouldn't experience any pain and avoid using the word electrical at any point. So a good way to say this is, we want to see how your heart is functioning and make sure that there are no abnormalities. Get them to remove any upper garments and make sure they are comfortable on the bed. Next up is the placement of the leads. There are 6 chest leads and 4 limb leads. V1, the first chest lead, is placed in the 4th intercostal space on the right margin of the sternum. V2 in the 4th intercostal space along the left margin of the sternum. V4 in the 5th intercostal space left mid-clavicular line, and V3 is placed midway between V2 and V4. V6 goes in the 5th intercostal space on the left side of the mid-axillary line, and V5 between V4 and V6. The green limb lead goes on the left ankle, the orange limb lead on the left wrist, the red limb lead on the right wrist, and the black limb lead on the right ankle. Tell the patient to remain nice and still whilst you take the recording. Make sure to transmit the ECG to the patient's record and print a copy. Ask the patient if they are experiencing any chest pain during the recording, and if they did, make sure to record this in their notes. The P wave on the ECG represents atrial depolarization, which results in atrial contraction or atrial systole. The QRS peak represents ventricular depolarization, and the T wave displays repolarization of the ventricles. When an ECG recording is done, the trace is printed on graph paper with lots of small squares, which makes it easier to calculate the following intervals. The PR interval is the time from the onset of the P wave to the start of the QRS. It reflects conduction through the AV node. The normal PR interval is between 120 and 200 milliseconds in duration, which is 3 to 5 small squares, and the QRS peak should be less than 120 milliseconds. So you get handed an ECG in the OSCE. Where do you start? Well, one of my favourite mnemonics for taking the examiner through the ECG is ARIBA. A stands for the electrical activity, R for the rate. A good way to calculate the rate of a regular rhythm is by counting the number of large squares between each QRS complex. Once you have counted that number of squares, divide 300 by this number and this will give you the rate. If the rhythm is irregular, then you should count 30 large squares, which is equivalent to 6 seconds. Count the number of QRS complexes in this time period and then times by 10 to get the rate over 1 minute. I is for irregular or regular rhythm. You can decide this by looking at the QRS complexes and seeing if they are equally spaced. If they are equally spaced, then the rhythm is regular, and if not, it is irregular. B is for broad or narrow QRS complexes, and remember a QRS complex should be around 3 small squares. If it is smaller than this, then it is narrow, and if larger, then it is broad. A stands for atrial activity, so can you see any P waves on the ECG strip? R stands for relationship, a relationship between the atria and the ventricles, so is there a P wave for every QRS complex? Let's use this ECG as an example. So first, is there any electrical activity? Yes, there is, because the rhythm strip is not flat. R is for rate, so can we see that there are QRS complexes, and are they regular? Yes, they are equally spaced, so the rhythm is regular. Let's calculate the number of squares between each QRS complex. It's 6, so 300 divided by 6 is 50. So beats per minute is around 50. B is for broad or narrow QRS complexes. The QRS complexes in this ECG are around 3 small squares, which is normal. A is for atrial activity, and P waves can be seen here, so that is normal too. R is for the relationship, and we can see a clear relationship between the P waves and the QRS complex. Medical students can find it difficult to read ECGs, and I have found the only way to get better at this is to read lots of them. Look at the normal ones first and then start to look at abnormal ones and recognise the patterns. You will get better over time, it just takes lots of practice. I hope this tutorial has been useful for you, and subscribe to OSCE Stop to see more videos like this. Also comment ideas or things you want me to cover in future videos. Thanks everyone.